Marijuana is included in the Drug Enforcement Administration Schedule 1 group of drugs. As such, it is legally categorized as being one of the most dangerous drugs with the highest potential of addiction and with no accepted medical use. Not even cocaine is in Schedule 1. But I'm here to talk about and refute the statement that medical marijuana has no benefits and should not be used in medicinal ways. And knowing that marijuana is in category 1 in grouping 1, it has still been legalized in 33 straight states according to medicalmarijuanaprocon.org. Now many people will argue with me, and the opposing team would say that there hasn't been no conclusive evidence, not a lot of data to support that medical marijuana is beneficial. That there is lack of information. This is stated in Dr. Samuel T. Wilkins' article. He states that data appraising the effectiveness of marijuana in conditions such as HIVs, epilepsy, chemotherapy associated vomiting is limited and often only anecdotal. It is true that medical marijuana has minimal test results, that it lacks information. But there are many studies out there stating that marijuana has benefits. In an article by Coastal Integrative Medicine, studies have shown that medical cannabis have fewer side effects in comparison to painkillers, and patients who use marijuana for medical purposes felt better overall. There are studies that show progress in ability of marijuana could limit the use of all these prescription drugs. There are some people out there taking 20, I'm not even exaggerating, maybe 20 to 25 pills a day. But it all could be limited to one, medical marijuana. Another aspect or argument that my opponent is that marijuana is an addictive drug. Stated in the article by Dr. Wilkins, data clearly shows that about 10% of these who use cannabis become addictive. The number is higher among adolescents. Users who seek treatment for marijuana addiction average 10 years of daily use. Now, I'm not going to argue that marijuana is not addictive. All drugs, and many studies have shown that they are addictive. Many people become addicted to many different kinds of medicines. Opioids. Now, if one of the reasons why people do not want marijuana in medicinal usage is because it's addictive, then let me ask you a question. Why is opioids or painkillers legal and prescribed to people in the United States? Why is it legal for people to take painkillers like opioids? One ingredient in these prescription painkillers is heroin, which is a very addictive drug and is illegal in the United States. But it's still being used. It's still being used today. Considering that it contains illegal drug ingredients, in an article by MidlinePlus.gov, risks of using prescription opioids include dependency and addiction. Dependence means feeling of withdrawal symptoms when not taking the drug. With this information, that means people will become more and more reliant on opioids, painkillers, wanting to get them more, so it becomes more addictive than medical marijuana. As an advocate of helping and progressing society, I believe that though with these side effects of using medical marijuana, like most drugs do, it is more medical benefit. It benefits society more than it hurts. Why do people not want medical marijuana allowed? It will benefit them greatly And with the side effects, there are plenty of drugs with side effects out there today. It all becomes trial and error, trial and error. Medicines become better, and sooner or later, medical marijuana will be in medical use. Thank you.